Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. Thank you for seeing me on such short notice.
Good morning. Don't worry about it. That's what I'm here for. What seems to be troubling you?
I've been experiencing severe abdominal pain for the past week. It's mostly on the right side, and it's intense enough to wake me up at night.
May I ask your age?
I'm 52 years old, doctor.
Have you been taking any medication for this pain?
Yes, I tried over-the-counter antacids and ibuprofen, but they haven't helped much. The pain seems to worsen after eating fatty or greasy foods.
Do you smoke or consume alcohol?
No, I don't smoke and I rarely drink alcohol.
I've reviewed your blood work and ultrasound results. Your liver enzymes are elevated, and the ultrasound shows gallstones and a slightly enlarged gallbladder. It seems like you're suffering from gallstone-induced cholecystitis. Your vital signs show a blood pressure of 135/85 and a pulse rate of 78. There are no signs of jaundice, but you do have some abdominal tenderness upon palpation.
What does that mean? What's our plan of action?
Given your symptoms and the results of the diagnostic tests, I recommend surgical removal of the gallbladder, known as a cholecystectomy. I would like to perform further tests, including a hepatobiliary immunodiacetic acid (HID) scan to confirm that the gallbladder is not functioning properly before we proceed with surgery.
That sounds serious. Is the surgery risky?
All surgical procedures come with some degree of risk, but laparoscopic cholecystectomy is generally considered a safe and effective treatment for gallstone-induced cholecystitis. However, we'll conduct a thorough preoperative evaluation to assess any possible risks in your case.
Okay, let's proceed with the additional tests then.
Great. I'll have my staff schedule you for a HIDA scan and a preoperative evaluation. After we have those results, we'll finalize the treatment plan.
Thank you, doctor. I appreciate your thorough approach.
You're welcome. It's important to address this properly to prevent any complications down the line. I'll see you soon for the follow-up.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Thank you for coming in today, Miss Johnson. I see you've been to your primary care physician regarding a series of headaches and bouts of dizziness. Could you elaborate on that?
Yes, doctor. It started a few months ago, and it's been really distressing. The headaches usually happen in the afternoon, and they're throbbing, mostly on the left side of my head. Light and sound make it even worse. The dizziness is unpredictable, but has almost caused me to fall a couple of times.
That does sound concerning. Is the headache constant, or does it come and go?
It comes and goes, but when it's there, it's almost debilitating. Over-the-counter medication doesn't seem to help much either.
Any other symptoms that accompany these episodes? Maybe changes in vision or nausea?
Yes, actually, I do feel nauseous often, especially when the headache is intense. And I've noticed my vision gets a bit blurry sometimes, mostly when I'm dizzy.
I see your GP referred you for an MRI. Did you have that done?
Yes, and they told me that the results didn't show anything abnormal. So I'm really not sure what's going on, but it's affecting my quality of life.
Understandable. Have you tried any lifestyle changes or other methods to alleviate these symptoms?
I've tried everything from changing my diet to incorporating exercise into my routine. A friend suggested aromatherapy, which seemed to help a tiny bit, but it's not a long-term solution. I've been drinking herbal teas too, which calm me down, but don't really address the headache or dizziness.
Do you have a family history of migraines or similar symptoms?
My mother used to complain about migraines, but she managed hers with medication. No one else in the family has anything like this as far as I know.
Thank you for the detailed information, Miss Johnson. Based on what you're describing and your family history, this could be related to migraines or another form of chronic headache, possibly accompanied by vertigo. We may need to explore more specialized tests and consider various treatment options like prescription medications.
Thank you, doctor. I just want to get to the bottom of this and start feeling like myself again. It started to interfere with my work and social life.
I understand, and we'll do our best to find a treatment that works for you. You're not alone. Many people experience symptoms like yours, and there are various treatment paths we can take. But first, let's get a more comprehensive diagnosis. I'll set you up for some more specialized tests.
I appreciate that. Hopefully we can figure this out soon.
I'm optimistic that we will. Thank you for coming in today. We'll be in touch soon with the next steps.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So, you've had the whitening gel on for about 20 minutes now. How are your teeth feeling? Any sensitivity?
No, I thought it would be really uncomfortable or I'd feel a tingling sensation, but it's fine. My gums feel a bit odd, though.
That's normal if you've never had a whitening treatment before. Sometimes the gel can irritate the gums a bit, but that should subside.
Okay, that's reassuring. But what if it doesn't whiten my teeth as much as I want?
Well, teeth whitening is generally a gradual process. If you're not satisfied with the results today, we can discuss additional sessions.
That sounds fair. Will it affect my tooth enamel, though?
When done professionally, the risks to your enamel are minimal. We use a safe concentration of bleaching agents here.
Great to know, thanks.
Now look at question 26.
Jen, can you come and assist me with Mr. Smith in room 7? He's the one who had hip replacement surgery last week.
Yes, I remember him. He's supposed to start walking today, isn't he? How is he doing on pain meds?
He's doing okay, still on mild analgesics, but he's hesitant about standing up for the first time. He's quite anxious about it.
That's understandable. Standing and walking after a surgery like that can be intimidating. I'll be there in a minute. Does he have his walker or crutches?
He has his walker, but he hasn't used it yet. We're at that stage.
Okay, I'll bring some extra padding for the walker handles. Sometimes that helps ease the first steps.
Good idea. Let's make it as comfortable as possible for him.
Now look at question 27.
Our focus this quarter is on enhancing medication adherence, especially for our older patients on multiple medications. We've introduced a system we're calling PillMinder. Basically, we provide pre-sorted blister packs, labeling each slot with the date and time the medication is to be taken. This way, there's a lot less confusion for patients. The patients or their caregivers just need to pop the pill out when it's time. We also offer to sync up prescription refills so they can pick everything up at once.
That's a wonderful initiative. How has the reception been so far?
It's been excellent, especially among caregivers who manage medication for their elderly parents. They find it so much easier to keep track of what's been taken and what hasn't. We're actually seeing an increase in medication adherence rates among the pilot group, so we're excited to make this a standard service across all our pharmacies soon.
Now look at question 28.
So, the ER just sent over the files for a 45-year-old patient complaining of severe headaches and blurry vision. They're worried about a possible brain tumor and are requesting an MRI.
An MRI would indeed offer the best resolution for identifying a brain tumor. Do we have any other clinical information? Any contraindications for MRI like a pacemaker or metal implants?
Not that they've reported, but you're right, we should double-check that. But I also wonder, should we start with a CT scan instead?
Well, CT is quicker and more widely available, but it's not as sensitive in detecting some kinds of brain abnormalities, especially for soft tissues. Plus, there's the issue of radiation exposure.
That's true. And if we suspect a tumor, we'll need the best resolution possible. So MRI it is then?
Yes, let's go with MRI. And if there are any contraindications we discover later, we can always reconsider our options.
Agreed. I'll update the ER team accordingly.
Now look at question 29.
All right, next on the list is Mrs. Johnson for a pacemaker implantation. What should we know about anesthesia?
She's generally healthy, but has a history of bronchial asthma. It's well controlled with medication, but it's something we should monitor.
Do we need to have a bronchodilator on standby?
Yes, let's have it just in case.
What's the plan for post-op?
We'll have her in the cardiac ICU initially for monitoring. She's on blood thinners, so we'll need to manage that post-op.
She might need a different type of blood thinner temporarily then.
Exactly. Especially with the implantation site, we don't want to risk any excessive bleeding.
Good to know. Anything else we should prepare for?
Well, she's anxious about surgeries. She's never had one before, so maybe consider using a mild sedative pre-op.
Excellent point. Let's make sure she's as comfortable as possible.
Now look at question 30.
We're exploring new avenues to enhance healthcare delivery, particularly in rural areas where accessibility is a challenge. One initiative we're considering is the implementation of telemedicine services. The idea is to have a multidisciplinary team offering consultations, follow-ups, and basic healthcare services through secure video conferencing.
That sounds promising. Any data on its effectiveness?
Studies indicate that telemedicine can be extremely beneficial for managing chronic conditions like diabetes and COPD. It can also serve as a useful platform for mental health services, including telepsychiatry.
And what about the cost implications?
That's something we're still examining. The upfront costs for the technology are there, but we expect that the savings from reduced hospital readmissions and emergency room visits would offset those costs in the long term. Our research aims to quantify these costs and benefits further.
Do you foresee any challenges with the rollout?
There's the question of patient and provider buy-in, of course. And then there are technical and regulatory challenges, including ensuring HIPAA compliance. We're working on solutions for these as well.
Very well. It seems like an initiative worth pursuing.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Ladies and gentlemen, I'm Dr. Jane Miller, a medical ethicist and researcher with a focus on the intersection of healthcare and artificial intelligence. Today, I'd like to discuss the growing use of AI in medical settings and the ethical questions that are increasingly arising as a result. I'll discuss the potential dangers and ethical challenges surrounding the use of AI in healthcare. When we talk about AI in healthcare, we're often discussing a transformative tool. AI has the potential to improve everything from medical diagnostics to treatment plans to patient monitoring and beyond. Indeed, machine learning algorithms are already being used to predict disease outcomes, provide clinical recommendations, and even assist in surgeries. But as with any powerful tool, it comes with its set of challenges and ethical considerations. One of the primary concerns is the issue of data privacy and security. Medical records are among the most sensitive data one can have, and the infrastructure to secure this data needs to be robust. While we have privacy laws such as HIPAA in the United States or GDPR in Europe, the question remains, how secure is secure enough? Cybersecurity threats to healthcare institutions are on the rise, and AI systems are only as secure as the weakest link in their network. Moreover, who owns the data? Especially when it's used to train machine learning models, patients, healthcare providers, the companies that develop these AI technologies, these questions become increasingly complex when you think about the multinational corporations involved, operating across different legal systems with varying privacy norms. Another concern is the issue of bias. AI algorithms are trained on data, and if that data is biased, the AI system itself could inadvertently perpetuate or even exacerbate existing healthcare inequalities. For instance, a model trained mostly on data from one particular ethnic group may not be as effective in diagnosing diseases in individuals from a different ethnic group. Yet another ethical challenge is the idea of informed consent. While a human doctor can explain a diagnosis or treatment plan in terms that a patient can understand, the underlying decisions made by machine learning models are often a black box, even to experts. How can we ensure that patients understand the limitations and risks associated with AI-assisted medical decisions? Let's take a case study. Sarah, a 45-year-old woman, was recently diagnosed with breast cancer. The hospital she goes to uses an AI system to predict patient outcomes and suggest treatment plans. The system recommends a certain type of chemotherapy based on its analysis of thousands of similar cases. Sarah wants to know why this particular treatment is recommended, but the doctors can only say that the system has had a high success rate with similar cases. Should Sarah trust this machine's decision when even the medical staff can't fully explain it? This is where we reach the boundaries of informed consent. Sarah eventually agrees to the treatment and fortunately has a successful outcome, but her case raises several ethical questions. In Sarah's situation, the AI tool had a positive impact. But what if it hadn't? Who would be responsible? The healthcare provider, the company that developed the algorithm, the data scientists who trained the model? In conclusion, while AI holds great promise for revolutionizing healthcare, it also poses a complex set of ethical challenges that we must address proactively. Questions surrounding data privacy, ownership bias, and informed consent are not just theoretical. They have real-world implications for the lives and well-being of patients. As medical professionals, ethicists, policymakers, and technologists, it's our collective responsibility to navigate these complex issues carefully, to harness the power of AI for the greater good, but without compromising ethical principles. Thank you for your time today, and I welcome any questions you may have.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone, and welcome back to the Dietitian Summit. My name is Dr. Emily Thompson, and I'm a researcher at the MJ Health Institute in London. I'm thrilled to be here today to share insights from our groundbreaking research in the area of gut microbiota and its influence on mental well-being. This topic is especially vital as we begin to recognize the intricate interactions between our gut health and overall health outcomes, including psychological states. As many of you may know, the gut microbiome is the community of trillions of microorganisms living in our digestive tracts. These microorganisms not only assist in digestion, but also have been linked to various aspects of health, from immunity to metabolism and even brain function. In fact, the gut-brain axis, a term gaining traction in recent years, describes the biochemical signaling that occurs between the gastrointestinal tract and the central nervous system. In order to dive deeper into these connections, we conducted a randomized, double-blind, placebo-controlled trial involving 120 participants, equally divided between males and females, with an average age of 40 years. Participants were excluded if they had known digestive disorders, psychiatric conditions, or were taking medications affecting the gut microbiome or mental state. They were randomly assigned to one of three groups, one taking a high-potency multi-strain probiotic, another consuming a prebiotic fiber supplement, and the last one receiving a placebo. The intervention lasted for 8 weeks, with assessments at baseline, midway, and at the end of the study period. Our preliminary results were astonishing. We found that those in the probiotic group reported a significant reduction in symptoms of anxiety and depression, as assessed by standardized psychological questionnaires. The prebiotic group also reported improvements, though to a lesser extent. Remarkably, there were no significant changes in the placebo group. Furthermore, subsequent fecal sample analysis revealed that there were significant shifts in the gut microbiome composition in the probiotic and prebiotic groups, most notably an increase in beneficial bacteria like lactobacillus and bifidobacterium. These changes correlated with the observed mental health improvements, suggesting a direct link between gut microbiome and mental health. While the results are promising, the study has some limitations. First, the duration of the study was relatively short, and longer studies are needed to establish long-term effects. Second, while the gut microbiome was assessed, no brain scans or biochemical markers were studied to directly confirm changes in the central nervous system. Finally, all participants were relatively healthy adults, so we can't generalize the findings to populations with existing digestive or mental health conditions. In conclusion, our findings suggest a pivotal role of the gut microbiome in influencing mental well-being, though more work is needed to elucidate the mechanisms involved. I'm hopeful that this area of research will pave the way for novel interventions for mental health disorders, perhaps through personalized microbiome-based treatments. Thank you for your attention, and I look forward to your questions.